हॅलो. हॅलो.
हॅलो मॅम.
आवाज येतोय?
हो मॅम.
ओके. आज का नाही आले बाकीचे स्टुडंट्स? झोपले का दुपारी?
माहित नाही.
मॅथमॅटिका संपलं ना?
हो.
ठीक आहे. टुडे वी विल स्टार्ट सपरेशन अगेन बाय H.A. रॉबर्ट. सपरेशनवर तुम्हाला 5 मार्क्सचा क्वेश्चन येतो. सो व्हॉट इज सपरेशन? एनी आयडिया अबाउट द सपरेशन?
स्टॉप करणं एखाद्याला गोष्टीला.
काय?
एखाद्या गोष्टीला थांबवणं.
अजून? एखाद्या गोष्टीला थांबवल्यामुळे this may leads to suppression. So the first stage of suppression is the palliation. If any disease is there, it may be of any kind and it may from any system. If it is not treated properly, then it will enter into the body. That infection is remain inside the body uh, because of taking the certain medicine. The patient may feel temporary relief, but it is not removed from the root. So that stage we called it as a palliation. But when this palliation is repeated, then this may leads to the suppression. So this suppression is one of the cause of the suppression is the large physiological doses. There are the three types of doses: physiological, uh, pathological, and therapeutic. So that we will see in the fourth year by the Stuart Close. So physiological dose means that is a large dose which is harmful to our body. So when the patient or any person is taking the large physiological dose for any type of disease, when there is a temporary relief to the patient, that is known as the palliation. And when this palliation increases or this palliation is number of time, then this may leads to the suppression. Clear?
मॅम एकदा परत बोला.
Repeated palliation may leads to the suppression. What is palliation? Palliation means temporary relief of the symptoms. कळालं?
हो मॅम.
Okay. So, suppression. Who will read this?
वाचू.
What's
Suppression of the disease with large physiological doses leads to development more deeper and chronic state of the disease. Dr. Robert explained with various examples.
yes?
In the
So, एक मिनिट huh? So, this is the summary of the suppression. So, suppression which is caused by large physiological doses. Physiological dose means which is harmful to our body, which
body.
contains the crude drug material, and you are giving in a large doses. So, because of that, there is a development of more deeper and chronic state of disease because the patient is palliated many a times, and that's why the acute disease is now become a chronic one. As the disease is goes more deeper and deeper, so he used the word more deeper and chronic disease. When that disease is superficial, at that time the patient use the large doses of the crude drug substance, and hence now it is penetrated deep, and hence he used the word here deeper and chronic disease. And he explained this separation with the various suitable examples कि हम लोग कब कब palliation करते हैं, and why this leads to the suppression. So the certain conditions where the patient is very much panic, patient requires the fast relief. Generally in that condition we are doing, or as a physician or the patient also wants the suppression. So he explained the various conditions where we are doing the palliation first and then suppression. So he has given the various example. The first example is related to the pain, the second is related to the natural eliminations, then the examples which are related to the surgery. So in this way he explained the various examples by which we can understand ki how the suppression occur and what is the bad effect of this suppression. ओके, क्लिअर? याच्यात काय काय आपल्याला बघायचंय?
Yes, ma'am.
नाव रीड.
In the dissertations on the vital energy, we pointed out that it was this force which was the expression of life itself, and through its power of development and control in itself, and by itself, it maintains the harmonious working, the state of equilibrium, which is perfect health.
एक मिनिट, हा
There
एकच मिनिट. In the dissertation on the vital energy, when he is writing the book, he said that ki the vital energy I am pointed out because this force is the expression of life itself. The importance of vital energy we know. What is the function of vital force, that also we know. As the vital force is not present in the body, the person is a dead person. If that vital force is present, then only we are the living being, and we are doing all the regular activities through the power of development. As the vital force is there, we can grow properly and we can develop properly. All the controls are with the vital energy. It maintains the harmonious working, and because of that harmonious working, there is a state of equilibrium. Equilibrium means all the functions are in a proper way. There is a proper assimilation, digestion, metabolism, formation of RBCs, WBCs, then the proper formation of the new cells, then formation of urine, formation of stool. So all the things are in a proper way, then that state is a equilibrium. The body temperature is within the physiological range, the blood pressure is within the physiological range, pulse is also the physiology in the physiological range. When all the components, all the parameters are within the range, then that state is the equilibrium. The patient is mentally, physically and socially behaving well. So, in short, we can say that ki physical and mental, when they are in within, or we can say it is within the physiological range, then this state is the equilibrium. So, this equilibrium is maintained by whom? Only by the vital force, and that
force.
state we called it as a health. So, if we want to preserve our health, the harmonious functions should be there inside our body. And these harmonious functions, if it is proper, then we called it as a state of equilibrium or the health. And this is only because of the vital energy. Now, read.
There are external forces that have great influence in inhibiting its normal functioning. When the normal function is inhibited, the immediate reaction is a lack of harmony and a warped and suppressed functioning of the vital force. so that disease conditions are produced with the attendant symptoms and irregular functions of the body.
Yes. So in the first few line, he explained about the health. Now, what happen if the external forces or the noxious morbific agent, when they are inhibiting, when they are acting on our body with a great influence? So what they will do? They will inhibit. Inhibit करणं म्हणजे काय?
थांबवणं ना.
Yes. So they will not allow to do the normal functioning. So when that noxious agent is acting on our brain, so there may be the mental equilibrium will not be there. If they are acting on the nose, we may have the different diseases of nose. If the noxious morbific agent is acting on the stomach, so the state of equilibrium of the stomach will not be there, and you may have the digestive problem. सो दे विल इनिबिट ते काम करू देणार नाही नॉर्मल फंक्शन करू देणार नाही when the normal function is inhibited the immediate reaction is a lack of harmony correct correct or not if the
Yes, ma'am.
harmony is not there then the functions are not proper बरोबर आहे
Yes, ma'am.
Yes, ma'am.
and wrap and suppress functioning of the vital force. So this is nothing but the suppression of function of the vital force so that disease conditions are produced with the attendant symptoms and irregular function of the body. So this leads to or the inhibition or the suppression of this vital force leads to what disease condition, and that disease is manifested in the form of symptoms and the irregular functions of the body. So what he has given in the first paragraph, that is the importance of health and the disease. So what is health and what is disease? So what is health? That is the harmonious working of all the um, organs. That means the state of equilibrium is present, and this is nothing but the health. This is the concept of health. There is a power of development and the control are in the hand of vital force. But when during this health, when the morbific noxious agent or any external forces, when they are acting on the body, they will not allow for the normal functioning. There is inhibition of the normal function. बिकॉज ऑफ दैट इनहिबिशन द हार्मनी विल नॉट बी मेंटेन आपके अगर फंक्शन ठीक से काम नहीं कर रहे हैं सो वहाँ पे हार्मनी नहीं होगी आइदर देयर मे बी द मेटाबॉलिज्म अगर डाइजेशन का प्रॉब्लम है तो मेटाबॉलिज्म का अल्टीमेटली प्रॉब्लम आएगा इफ़ यू आर टेकिंग द लेस अमाउंट ऑफ न्यूट्रिशन द डब्ल्यू और आरबीसी आपके ठीक नहीं बनेंगे if you are going outside in the cold air then you may have the cough and coryza so in that case the harmony will not be maintained the state of equilibrium is not there because the noxious agents are acting on your body and this leads to the suppression of the function of vital force and how it is manifested in the form of symptoms and irregular functions of the body. So this is the concept of health and the disease. Clear?
Yes, ma'am.
Yes, ma'am.
Read next lines.
Let us consider some of these external features that may thus suppress the normal functions of the vital force. First one is intense, unsatisfied longing for mate or offspring, unrequited love, grief from loss of family or friends, business apprehensions and worries, disappointed ambitions, extreme fatigue, or exhaustion. All these forces have an influence upon the vital energy and so react and suppress its natural functioning that a train of symptoms is produced, varying in their manifestation. but each varying widely from the natural expressions of the vital energy. We often see cases where these suppressing emotions not only affect profoundly the single individual but extend their influence to the next generation through the effect on a nursing mother.
Yes, thank you. So here they have given the certain examples कि in that condition there is a suppression of the symptoms. कौन से conditions है वो? Now let us consider some of these external features that may suppress the normal function of the vital force. In the previous paragraph, we have seen that certain noxious agents or the external agents, they are acting on the vital force, and they lead, this will act on the vital force and they suppresses the normal function of the vital force. Through the vital force, the normal functioning of the body will not be there. सो कौन से कंडीशंस है ये कि जो वाइटल फोर्स पे एक्ट करेंगे उसको सप्रेस करेंगे. सो फर्स्ट वन इज द शॉक, फ्राइट, फियर, excessive joy, intense unsatisfied longing for mate or offspring, unrequited love, grief from the loss of family or friends, business apprehension, worries, disappointment, ambitions, extreme fatigue and exhaustions. So these are the certain conditions which hamper our body. We know the different types of shock, we know the fright, we know the fear, we know the excessive joy. किसी चीज़ का डर लगता है, किसी चीज़ से बहुत ज़्यादा हमको जब खुशी होती है. So what happen? Or there is an intense unsatisfied longing for the mate or offspring, then there is a grief of loss of a family or the friend, yeah, business apprehension hai. So whatever may be the problem, because of that problem, it may be the physical or it may be the mental, our behavior will change. For example, now you are not having, suppose you are not knowing the date of the examination, then your routine is different. कि you are waking up late, you are going to bed late, you are moving here and there, you are chit chatting with your friends, you are doing the some work of the college, you are doing the study for a very some time, if you are getting the time only. But as soon as the university declares the exam date, from that day your timetable changes suddenly. You wake up early, you are doing more amount of study, you are not chit chatting, you are not on the social medias for the longer period of time. So you are concentrating only on your studies. If the university declares the date which is very nearby, where the examinations are very soon and you are not having the enough amount of time period, so at that time your routine will totally change. Similarly, when you are so in that case you are became a anxious, you apprehensive, or the you are having the funk of examination, थोड़ा डर लगता है ना हमको examination का. So in that case your behavior will totally change, your physical and the mental appearance will also change. So by taking the, or when you are doing the hard work, your body will also show the certain effects. If you are not sleeping properly, if you are waking early, then this may leads to the different symptoms. आपको headache होगा, या आपको weakness होगा, या dark circles आएंगे आंखों के नीचे, आपको थकावट होगी, fatigue feeling होगी आपको, because you are doing a lot of mental work. क्यों? Because you want to pass or you want to clear that examination. सेकेंड एग्जाम्पल आप ले सकते हो, इफ यू हैव क्वारल विथ योर फ्रेंड, तो छोटा मोटा झगड़ा हो गया है आपका अगर आपके फ्रेंड से, सो एट दैट टाइम ऑल्सो योर बिहेवियर विल चेंज. आप शांत रहना पसंद करोगे, या फिर कोई कोई लोग बड़बड़ बड़बड़ करेंगे, दे वांट्स टू बी अलोन, या कोई जो है वो दूसरों के साथ शेयर करेंगे. सो again your bodily response and your mental response will totally change. So that leads to the इन इक्विलिब्रियम, और यहाँ पे इक्विलिब्रियम आपका मेंटेन नहीं रहेगा। यू फील वीकनेस, आपको भूख नहीं लगेगी, हमेशा हमेशा आप वही सोचते रहोगे कि उसने क्या बोला, फिर मैंने क्या बोला, अब इसको कैसे सॉर्ट आउट करें। अगर एग्जामिनेशन है तो आप हमेशा वही सोचोगे कि ये क्वेश्चन आएगा कि वो क्वेश्चन आएगा। सो डिफरेंट पर्सन विल रिएक्टेड डिफरेंटली। तो जब आपका जो पहले का रूटीन था एक दिन पहले का, वो सडनली दूसरे दिन चेंज हो जाएगा, बिकॉज ऑफ दिस एंजाइटी, बिकॉज ऑफ द एम्प्रीहेंशन, वॉट एवर मे बी द रीजन, बट दिस अफेक्ट योर फिजिकल लेवल as well as the mental level. So this may leads to the inequilibrium in your body. Little bit the functions of the vital force जो हार्मोनियस थे वो थोड़ा सा गड़बड़ हो जाएंगे, और ये मैनिफेस्ट कैसे होंगे आपको कि भूख नहीं लग रही है, थकावट है। So these are all the conditions where there is a suppression of the vital energy, because all these influences on your vital energy, and hence the number of symptoms will be produced. The train of symptoms may produce because of that reason, varying in their manifestation. मैंने ये पहले ही कहा कि एग्जामिनेशन आता है तो कोई बच्चे को सर्दी खांसी हो जाती है, किसी बच्चे को एब्डोमिनल डिस्टरबेंस होता है, किसी बच्चे को चक्कर आती है, कोई एकदम शांत हो जाता है। सो द मैनिफेस्टेशंस आर डिफरेंट अकॉर्डिंग टू द इंडिविजुअल. So this natural function will get hampered and it will show the train of symptoms, but each varying widely from the natural expression of vital energy. We often see the cases where these suppressing emotions not only affect profoundly single individual but extend their influence to the next generation through the effect on the nursing mother. So if the person is having the suppression of emotions, कोई भी इमोशंस उसके रहे, एक्सेसिव जॉय रहे या ग्रीफ रहे या लॉस रहे, वॉट एवर मे बी द इमोशन, if it is get suppressed, so it will not be limited टू दैट पर्टिकुलर इंडिविजुअल, क्योंकि वो वैसे ही बिहेव करेगा। सो उसके बिहेवियर से उसके जो घर के लोग हैं उनका भी बिहेवियर चेंज होगा। इफ अगर वो बहुत चिंता करता है तो फैमिली मेंबर्स भी उसका ध्यान रखने के लिए उसको अलग अलग तरीके अपनाएंगे। सो द रूटीन विल गेट डिस्टर्ब। सो अगर कोई हमारे इसमें बीमार भी होता है घर में, इफ दैट पर्सन इज हैविंग द फीवर, so we are disturbed. So ये जो person है, they is having the certain shock or some having the fear or they may have the fatigue which is mentally and physically imbalance हो गया है। ऐसे इसमें वो एक जो पर्सन है हमारे घर का सिर्फ वही टेंशन में नहीं रहता है, पूरा घर टेंशन में आ जाता है। सो दिस इन्फ्लुएंसेस द होल फैमिली। और यही, if that lady is pregnant, if that lady is in a lactating period, then this may reflect to his child through the feeding. Whenever she feeds the baby, all the थिंकिंग जो भी उसके दिमाग में चल रहा है, ऑटोमेटिकली इट विल रिफ्लेक्ट टू हिज बेबी, टू हर बेबी, थ्रू द फीडिंग एज ही इज़ द नर्सिंग मदर। सो जो भी फीडिंग के वक्त अगर आपके पास पेशेंट भी आती है गायनेकॉप्स की, तो आपको उसको वही बोलना है कि इन द लैक्टेटिंग पीरियड whenever she is doing the feeding to her baby, he should think positiveness, he should take all the things positively, क्योंकि through the milk it is she is giving her thoughts to the baby. फीडिंग के वक्त हमेशा जो एटमॉस्फेयर है इट शुड बी अ पॉजिटिव वन इन द होल प्रेगनेंसी। भी वो लेडी को आपको बोलना है कि शी शुड बी पॉजिटिव, बिकॉज वो जो थिंक करती है, वो जो बिहेव करती है, अल्टीमेटली दिस अफेक्ट्स द पर्सनैलिटी ऑफ द चाइल्ड। सो इन दिस वे अगर ये सप्रेशन होता है बिकॉज ऑफ एनी रीजन, तो क्या होगा, बिकॉज ऑफ इन्फ्लुएंस ऑफ ऑल दीज फैक्टर्स, ये जो वाइटल एनर्जी है उसका ये जो नॉर्मल फंक्शनिंग है वो इनिबिट हो जाएगा, एंड इट विल शो द ट्रेन ऑफ सिम्टम्स। एंड ये सिम्टम्स जो है दे मे ट्रांसफर टू द नेक्स्ट जनरेशन इफ दैट lady is pregnant or that lady is the nursing mother. So in this way, because of the suppression of emotion, the next generation may get affected. Clear?
Yes, ma'am.
Yes, ma'am.
So, two concepts we have seen: health, disease, and the third one is the certain conditions we have seen. Which are the conditions by which the vital forces get suppressed? So, these conditions may be shock, fear, fright, unsatisfied love, or the loss of family member, or the business apprehension, whatever may be the external reason. This hampers the regular activity of the vital energy, that is the suppression of vital energy, and then this may express in the form of signs and symptoms. And these suppression symptoms of suppression may transfer from one generation to the another generation. Clear?
Yes, ma'am.
Yes.
Yes, ma'am.
पुढचं वाचा.
The palliative effect of medicines in physiological form is the condition that we see over and over again, and we can observe the sequence of suppressive action, the results being first palliation and then suppression, or an actual aggravation of the first condition. There are always the primary and secondary action as a result of physiological doses, and we see it well expressed in paragraph 59 of the organelle, where
Bas.
Hahnemann says.
Bas. So here he has given the reference, or what is the prerequisite thing for the suppression. So the prerequisite thing for the suppression is काय लागतं सपरेशन होण्याच्या आधी? सपरेशनच्या आधी कोणती स्टेज येते?
Palliation.
पॅलिएशनची. सो हे त्यांनी इथे तेच सांगितलंय. द पॅलिएटिव्ह इफेक्ट ऑफ मेडिसिन. कशा मेडिसिन? दॅट इज अ क्रूड मेडिसिन, आणि डोजेस दॅट इज अ फिजिओलॉजिकल डोजेस, दॅट इज अ लार्ज डोज. Form is a condition that we see over and over again. So if that person is doing the palliation with a large dose with a crude medicine repeatedly, so what will happen? We can observe the consequence of suppressive action. So palliation का result किस में होगा?
Suppression.
Suppression में. In a result being first palliation and then suppression, or an actual aggravation of first condition. So palliation, because of large doses, this may leads to the suppression. There are always the primary and secondary action as a result of physiological dose. We know the primary action and secondary action. What are they? Primary action, secondary action.
Primary action is of medicine.
बरोबर. आणि secondary action.
Secondary action is of vital force.
बरोबर.
Vital force.
Very good. So in the primary action, the medicine will act on our body. If that medicine is opposite, the secondary action कोणती येते?
Secondary counteraction.
Very good. आणि समजा सिमिलर मेडिसिन असेल तर? मेडिसिन जर सिमिलर असेल तर सेकंडरी
Curative.
ऍक्शन
Curative.
क्युरेटिव्ह.
Curative.
Yes, right. So there is no question of palliation. So if the medicines are crude one, when they are giving in a physiological dose, then this may leads to the first palliation and then suppression. या फिर क्या होगा? Actual aggravation of the first condition. There are always the primary and secondary action as a result of physiological doses. we have seen this कि अगर जल गया है, so what we are advised, थोड़ा सा भी अगर हाथ जल गया है, so what we are doing, we ask that, we will ask कि pour the some lukewarm water. But what the allopathic physicians are doing, they will keep the hand in the cold water. This is in the primary action, the patient feels better, that is the palliation. But what happen in the secondary action, that part will become more inflamed. हे एक्झाम्पल बघितलं होतं ना आपण. दुसरं एक्झाम्पल आपण बघितलं होतं की ड्युरिंग द कॉन्स्टिपेशन द ओल्ड फिजिशियन्स आर गिविंग द पर्गेटिव्स, की त्याच्यामुळे काय होतं की त्याचे जे पेरिस्टॅटिक मुवमेंट्स आहेत ते वाढतील आणि द पेशंट विल फ्री फ्रॉम द कॉन्स्टिपेशन. हे झालं प्रायमरी ॲक्शन, पण ते टेम्पररी राहणार आहे. सेकंडरी ॲक्शनमध्ये काय होणार, द पेशंट विल हॅव मोर अँड मोर लूज मोशन्स, ऑर द पेशंटची जी कंडिशन आहे, जे ओरिजिनल सिम्पटम्स आहेत, ॲक्च्युअल symptoms, they may get aggravate and this may leads to the different complications. So because of the physiological doses, the primary action and secondary action, this may leads to the palliation that we have seen in the organ on aphorisms. Clear आहे इथपर्यंत?
Yes,
Yes,
ma'am.
ma'am.
So first we have seen the health, second we have seen the disease, in the third point we have seen the different components by which there may be the suppression inside our body, जसं फिअर, फ्राईट, आणि बिकॉज ऑफ दॅट काय होतं, नॉर्मल फंक्शनिंग ऑफ द व्हायटल फोर्स प्रॉपर राहत नाही, आपलं बिहेवियर पण प्रॉपर राहत नाही, कुठेतरी आपण फिजिकली आणि मेंटली डिस्टर्ब होतो. आणि दिस मे लीड्स टू द, सतत ते तसंच तसंच राहिल्यामुळे त्याला व्यवस्थित मेडिसिन न दिल्यामुळे तिथे पॅलिएशन होईल पहिले, आणि नंतर ते पॅलिएशन कन्वर्ट होतं सप्रेशनमध्ये. There are always the primary and the secondary action for the palliation, and then this may leads to the suppression. Clear आहे एवढे points?
Yes,
Yes,
ma'am.
ma'am.
So what the Hahnemann says about that paragraph, की such palliative antipathic remedies. So जसं आपण आधीच म्हटलं होतं की the medicines are in a crude form, physiological dose म्हणजे large dose मध्ये ते आपण दिले आहेत. आणि what is the relation of medicine to that of the disease? That is antipathic, that is the opposite medicines he is giving. Were never employed in allaying the prominent symptoms of protracted disease. We should not give the antipathic treatment कि जो वहाँ पे क्योर नहीं करेगी, without being followed in a few hours by the contrary condition, that is the return of evil after seriously aggravated. So कुछ टाइम के लिए patient feels better, लेकिन after the some few days or the months, the evil will return, that is the disease will return back again, and at this time this became more serious, or this is in the aggravated form. So we should not employ any medicine, any antipathic medicine which leads to the palliation, and ultimately this leads to the suppression. Clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
तेजश्री वाच इथून.
The paragraph continues speaking the use of the opium in suppressing cough and the use of the same drug in diarrhea and coffee producing exhilaration and other physiological primary effects in common practice. Then he goes on to show the secondary effects as being but an aggravation of the first condition or an entirely different group of symptoms of deeper significance.
So have you remember the examples of primary act, secondary action? आपण लिस्ट केली होती, आठवत आहे? लिस्ट नाही केली का तुम्ही? मी तुम्हाला सिम्पटम्स, प्रायमरी ऍक्शन आणि सेकंडरी ऍक्शन असे कॉलम करायला सांगितले होते, आठवतं?
हो, हो, ma'am.
Ma'am.
सो कंप्लेंट काय होतं? कॉन्स्टिपेशन. मेडिसिन कोणती दिली? परगेटिव्ह.
काय मॅम?
प्रायमरी ऍक्शन मध्ये काय झालं? द पर्सन मे हॅव द लूज मोशन. बट व्हॉट हॅपन इन द
Constipation.
secondary action?
Worse.
Worst condition. Second example we have seen regarding coffee. कॉफी कधी दिली होती पेशंटला? कॉफी कोणत्या कंडिशन मध्ये दिली होती?
Copy. Yeah. Transient. ते.
एक्सेसिव्ह जॉय करता
हा.
किंवा स्लिपीनेस असेल तर, म्हणजे थोडीशी झोप उडेल म्हणून कॉफी दिली होती. सो त्यांनी काय झालं, जे एक्सेसिव्ह जॉय होता तो अजून ॲग्रिवेट झाला. थोड्या काळाकरता पेशंटला बरं वाटलं, पण दिस इन्क्रीजेस. जे स्लिपीनेस होतं ते इन द प्रायमरी ॲक्शन पेशंट झोपला नाही, पण त्याच्यानंतर पेशंट खूप जास्त झोपला आणि त्यामुळे काय झालं, नंतरच्या नाईट्स त्याच्या स्लीपलेसनेस नाईट झाल्या. So these are the effect of taking the crude drug substance, and this leads to the palliation and suppression and other physiological primary effect in common practice. Then he goes to show the secondary effect of being but aggravation of the first condition or entirely a different group of symptoms of deeper significance. So secondary action मध्ये काय झालं? Always there is the aggravation of first condition or the entirely different group of symptoms appear which is having the deeper significance. So constipation, diarrhea, again constipation, and this constipation may leads to the deeper complications, that is it may leads to the piles or it may leads to fistula. Sleeplessness, coffee, sleepiness, but afterward the patient became again sleeplessness for many days. Again coffee, when it is given for the excessive joy, the patient feels better, but after that the patient may have the mania. So in this way we have seen the lots of example of the primary action and secondary action. So in the secondary action there may be the aggravation of the first or entirely the different group of symptoms are appear which are having the deeper significance. So in this paragraph he said that because of the large doses of physiological or the physiological doses of any medicine which you are giving in a crude form, in the primary action the patient feels better temporarily, but in the secondary action this leads to the suppression. Clear?
Yes, ma'am.
Yes, ma'am.
So next one, what the homeopathic physician should do in this condition. Who will read this paragraph?
वाचू?
मॅम मी वाचू?
कोणीतरी एकच वाचा.
The homeopathic physician constantly comes across drug effects in physiological form which have suppressed the natural expression of diseases. The one thing we should always bear in mind and should hold as our aim is to allow the vital force to express itself in its own chosen way. When it is deranged, it is only when it shows itself clearly and without interruptions in its natural development that we get a clear picture of the diseased state, and the administration of physiological medicine at such times changes the whole picture, suppressing one symptom after another until there is no expression of true condition of the patient.
Yes. So here he has given the role of the homeopathic physician. What he wants to do. A homeopathic physician constantly come across the drug effects. So हमेशा मैं बोलती हूँ कि पेशेंट हम पहले सबसे पहले अगर हमारे पास आता है सो दैट इज अवर गुड लक. लेकिन बहुत सारे जो पेशेंट्स हैं दे आर फर्स्ट गोइंग फॉर द old school medicine. They are going to the allopath for any reason. लेकिन वहाँ पे जब उनको क्योर नहीं होता है, जब वहाँ पे आराम नहीं मिलता है उनको, देन दे आर कमिंग टू अस. सो ये होम्योपैथिक फिजिशियन को नया नहीं है कि दे आर रिमूविंग द ड्रग इफेक्ट of the crude drug medicine in the physiological form, and because of that there is a suppression of natural expression of the vital force or the natural expression of the disease. ये हमेशा ही होम्योपैथिक फिजिशियन फेस करता है. The one thing we should always bear in mind and should hold as our aim, लेकिन ये कंडीशन में एच ए रॉबर्ट क्या बोलते हैं कि व्हाट शुड बी आवर एम, कि जहाँ पे नेचुरल एक्सप्रेशंस आपको नहीं मिल रहे हैं, ओरिजिनल सिम्टम्स आपको नहीं मिल रहे हैं बिकॉज ऑफ द फिजियोलॉजिकल डोजेस ऑफ देयर मेडिसिन, लार्ज डोज उन्होंने दिया है. तो वहाँ पे क्या होगा, हमारा एम क्या होना चाहिए, टू अलाउ द वाइटल फोर्स टू एक्सप्रेस इटसेल्फ इन इट्स ओन चूजन वे व्हेन इट इज डिरेंज. सो ज़्यादा से ज़्यादा हमको ऐसी मेडिसिन देनी है कि बाय विच द वाइटल फोर्स विल शो this on the original symptoms when it is deranged previously. हमको वो जो मेडिसिनल सिम्टम्स है और जो ठीक हो गए हैं, जो बचे कुछ सिम्टम्स है, ऐसे हमको नहीं चाहिए. सो व्हाट वी वांट द ओरिजिनल सिम्टम्स when that vital force is deranged previously. It is only when it shows itself clearly and without interruption in its natural development that we get a picture of disease state. So अगर आपको पहले के ओरिजिनल सिम्टम्स अगर आपको मिलते हैं बिफोर द एडमिनिस्ट्रेशन ऑफ फिजियोलॉजिकल मेडिसिन, so that will help to form a whole picture. सप्रेसिंग सप्रेशन ऑफ सिम्टम के बाद का अगर आपको मिलता है, सो इट इज़ डिफिकल्ट टू गिव द मेडिसिन, वो पूरी तरह से पेशेंट को ठीक नहीं करेगा. सप्रेसिंग वन सिम्टम आफ्टर अनदर, so this leads to the false picture of the disease. In that case you will not get the true picture of the patient or that disease. So we what is our role here, कि वी हैव टू गिव द सर्टन पीरियड ऑफ टाइम, या फिर हमको ऐसा कुछ करना चाहिए कि द वाइटल फोर्स विल शो द ओरिजिनल सिम्टम्स. सो आवर ड्यूटी और आवर रोल यहाँ पे क्या रहता है कि हमको ज़्यादा से ज़्यादा ओरिजिनल सिम्टम्स मिले. सप्रेशन वाले भी नहीं चाहिए हमको सिम्टम्स, और पैलिएशन वाले भी यहाँ पे हमको सिम्टम्स नहीं चाहिए. वी वांट द ट्रू पोर्ट्रेट ऑफ द डिसीज, या पहले के जो सिम्टम्स थे वो हमको यहाँ पे चाहिए टू ट्रीट द पेशेंट. क्लियर?
Yes, ma'am.
Yes, ma'am.
Read this.
Raju?
How?
The immediate effect of this method of treatment is a suppression, but if persisted in and continued over a period of time, it has the effect of driving the vital energy to express itself in some other form, and usually in deeper and more vital organ.
एक सेकंड. rejoin the meeting after 5 minutes. Okay.
Okay, ma'am.